So without further ado, I would like to introduce our very first speaker for this morning. Our first speaker is co-listed with Bill Gates and the world's greatest achievers in the 25th edition of Marquis Who's Who in the World. He is an author for Mosby, Elsevier, and Jones and Bartlett Publishers, USA. He has over 25 years of teaching and administrative experience in test preparations, including graduate and undergraduate nursing programs. He was named one of Go Negocio's first 50 inspiring Filipino entrepreneurs in the Philippine Graphics Magazine's 2006 Young Leaders of the Philippines. He received the MVP Bossing Award for Education, the Agora Award for Entrepreneurship from the Philippine Marketing Association, the SME IT Award for Innovation from the Philippine Internet Commerce Society, and the 10 Outstanding Filipino Entrepreneurs from Entrepreneur Magazine. And of course, the Young Market Master for Entrepreneurship from Mansmith and Fielders. He was accepted as a member of the Ernst & Young Entrepreneur of the Year Academy. Currently, he serves as a trustee of the Philippine Center for Entrepreneurship, or PCE. He is a recipient of 2 doctorate degrees from 2 state universities in the country, the Ramon Magsaysay Technological University and the Pangasinan State University. He finished his Bachelor of Science in Nursing cum laude and the Master of Arts in Nursing summa cum laude at the University of Santo Tomas. He was a board top-notcher in the Philippine Nurse Licensure Examination, where he obtained a rating of 89.20%. He obtained his post-baccalaureate certificate in e-learning design and Master of Education in Learning, Design, and Technology at the Pennsylvania State University, where he finished both courses with a grade point average of 4.0. Ladies and gentlemen, Dr. Ray A. Dapus. Good morning, Dr. Ray.
Good morning, Sir Miko. Good morning, Ma'am Glenda. And good morning to our RNs to be. And claim it. As Ma'am Vicky said, all you have to do is to study and pray. So with the entire Health Carousel team behind you today, giving you the support that you so dearly needed to pass the test, walang dahilan kung bakit hindi ka magtatap or pumasa. Nandito kami ni Ma'am Glenda para ibigay sa inyo yung ating run-up focus na tinatawag. Okay? So, sa lahat ng mga nandito ngayon, pakilagay lang na para makakuha ng 80% rating and above. Type it on our chat box. Everybody, once again say, I believe I will top the board. Go! I believe I will top the board. Yan, sige. Ang dami. Okay? So maraming salamat sa inyong pagtitiwala sa ginagawa ng Health Carousel Philippines para iangat ang kalidad ng kabuhayan ng bawat healthcare professional dito sa Pilipinas, lalong-lalo na sa ating mga nurse. Several years ago, katulad nyo rin ako, several daw. Anyway, so now, it's exactly 7 days before the test. But don't be so anxious. Don't despair. What if I tell you that after today's session, you would only need to focus on 3 things to study? 3 na lang ang dapat mong pag-aralan. Question, sir, ano yung 3 yon? Oops, not so fast. Before we get down to those 3 things that I would highlight today, let me tell you that a PDF copy of the slides of my presentation would be made available to all of you who are present in today's activities. Now, we are deluged with registration, and I believe there were more than 1,000 who registered for this webinar. But as we say, hindi tayo nakakasigurado sa power. Okay? So, doon sa mga areas, because some of those participants na last time nagkaroon ng power interruption sa areas nila, they sent me an email. And stay tuned because we're gonna upload this eventually and we'll give you an advice kung saan nyo makikita yung link. Okay, ready na ba tayong mag-top ng board exam? Say yes. Pakilagay nyo sa ating chat box. Yes, kung ready ka na mag-top ng board. Go! Ayan. Ang daming naniniwala. Ready na silang mag-top ng board exam. Ayan, with exclamation point. All caps pa. Yung iba, sabi niyo sa top 1, that's the attitude, that's the winner's attitude. Hindi mo kailangan maging first-timer para mag-top sa board exam. Remember the story of the great Senator Claro M. Recto? There has been stories that say that he initially flunked the bar and then eventually when he retook it, he topped it. At wag ka nang lumayo, may na-mentor akong dalawa. Okay? Na initially, flunker din. And eventually, yung isa naging number 7 sa board exam. At yung isa naging top 10. Hindi mo kailangang maging excellent student. Naalala ko yon. Tumawag pa yung school nung isa just to verify talaga sa amin kung talaga daw nag-top yung estudyante nila. Kasi medyo may pagkapasaway daw yung estudyante dun sa school. And we said, oo naman po. So anong kailangan mo para mag-top ka sa board exam? Hindi mo kailangan na graduate ka dito sa sentro. Majority ng mga minentor ko, 5 out of the 7 I mentored na naging number 1 out of the 285 board top notchers that I mentored, ay galing sa probinsya. So tayong mga probinsyano, look at my skin, sunog sa araw yan. Okay? Na nangunguna tayo, may kalamangan tayo over the rest. Maybe because we are determined to prove ourselves more. Kaya, stick around and you will learn how to maximize your strength when you are answering questions in the board exams. So, let me share with you an inspirational message coming from one of my participants. Okay, hello Sir Ray, sabi ni Lou, I'm so happy last night, first time ko maka-attend live streaming ng lecture mo, and my brains was so full. Hehe, your laughs and jokes are so contagious, nakaka-stress-free po kayo, nakakagana po kayo kasama mag-group study. Again, salamat po sa lahat-lahat, nakakabilib po kayo Sir, promise. Natouch ako pa na inom nyo ng tubig. Okay, syempre nanunuyo na ilalamunan ko for talking and talking. Kaya gusto ko po ipaalam sa'yo personally na appreciate ko po or namin lahat yung effort nyo. Hands up po ako sa inyo. My salute to you, Lou. I just hope you get the goal that you are setting for yourself. And of course, I also receive a message from Jenny. Hello, Doc Ray. I'm Jenny. Just want to say thank you for this day na inspire niyo po ako, lalo na at this time na nawawalan na po ako ng motivation. Salamat po and God bless you. I do agree. There's a recent study, 2020, because of the pandemic, okay? Most students now are suffering from 3 things. Ang acronym nga SAD, S-A-D. Okay? Stress, anxiety, and depression. But at any point in time, nandun naman yung anxiety. Okay? At any point in time, find comfort in the thought that the difficult situations would usually lead you to your most cherished dreams and goals. And as they say, even if you've done your best, you have to wait for the right timing. Remember, God gives you what you would want to have at the most appropriate time when you can best appreciate it. Okay, so thank you so much for getting up early in the morning today as everybody else. Na-inspire at na-motivate kayo to get up in the morning and roll up your sleeves and keep the ball rolling. Sabi nga ni Dale Carnegie, most of the important things in the world have been accomplished by people who have kept on trying when there seemed to be no hope at all. And one student actually emailed me last night asking me, Sir, paano ko ba ibabalance yung time ko? Sabi niya, I'm a single mom, I'm working, and I'm studying for the boards. One thing I can tell you, wag na tayong lumayo. I was once also a working student like you. During the time that I was doing my nursing course, okay, ako rin po ay crew ng isang fast food chain, okay, sa Holiday Plaza. Ayan. So naka-station ako sa grill. So dun sa first day ko pa lang, no, ang nasira ko dun sa aking station, more than 1,000 pesos. E nung panahon na yon, ang sweldo ko lang 11.25 per hour. So this is my pay slip. Nakaka 928 pesos ako every payday. Na nung panahon na yon, eksakto na yon para sa allowance ko. Okay? Na ang allowance ko nga, sabi ko sa'yo, 10 pesos. Ano yun, sir, 1960s? Hindi Okay. So, kasya ba yung 10 pesos? Oo, dun ako kumuha ng pangkain ko. Okay? So, Yung 6:25, ibibili ko yun ng isang latang sausage. Ulam ko yung 2 sa umaga, ulam ko yung 3 sa tanghali, ulam ko yung 3 sa gabi. At ang kanin nun, 125 per rice. Okay? Doon tayo bumabawi. Kaya lang, I have to walk 2 blocks away from UST para makakain ng murang kanin. Eh sir, sakto lang yun 375 plus 625, di 10 piso. Paano yung snack mo? Doon pumapasok yung tinatawag nating abilidad. Or, pag gusto maging social, nagiging social climber. Okay? So, I stay in a dorm where there are a lot of medical students and nursing students na mayayaman. So, I hang out with them, especially pag lunchtime na. Kasi mahilig silang manlibre, di ba? Saka minsan, niyayaya ko sila dun sa mga hindi pa nila nakakainan na point-point. Ano yun, sir? Turo-turo. Okay? At habang nag-order sila, usually pag mga pangmayaman, kompleto ang meal niyan. May fish, may meat, may vegetable. Ako, kanin na lang in-order ko para habang kumakain kami, kukwentuhan ko silang kukwentuhan at nakikitikim na rin ako ng ulam nila. Okay? So yung natitipid ko na 625 eventually would be enough to buy me 3 days of snack. Kasi magkano lang naman ang Mountain Dew noon? 175. Magkano lang naman ang Banana Q? 75 or 50 cents. So, nung ako ay naging faculty member na ng UST eventually, nilibre ako ng co-faculty ng Coke at saka Banana Q. Yung Banana Q, sinuli ko. Yung Coke, kinuha ko, bumili ako ng siopaw. Sabi niya, aba, ang Rega po, social, tinanggihan ng Banana Q ko. Sabi ko, ma'am, hindi naman po sa ganun. Kaya lang po, sa loob po ng 4 na taon sa pag-nurse, ang aking snack po ay Banana Q, Mountain Dew, Banana Q, Mountain Dew. Mapait na po ang dila ko sa kaka-Banana Q at Mountain Dew. Kaya ngayon, na ako instructor na, ay, siopaw naman. Those things that I went through as I was a struggling student, working my way to eventually earn my degree, of course, with the help of my siblings and my parents, eventually propelled me and pushed me further to reach my dream. Sir, ano yung picture na yan? That's Tony Tan Kak-chong, who owns Jollibee. And in 2005, we both represented the Philippines in the World Entrepreneurs Summit in Singapore. So we were both members of the prestigious Ernst & Young Entrepreneur of the Year, where I was the first nurse entrepreneur to be accepted as a member. So, pinagpala po tayo ng Panginoon. Saan ba tayo nag-umpisa? Kaya yung mga working moms dyan ngayon, yung nag-email sa akin kagabi, yung mga single moms na nagtatrabaho double time, come on, sit back, relax. Okay, we'll do the work for you in the next 3 hours with Ma'am Glenda, and we could give you a sense of focus. Okay? Don't despair. Life is good. Okay. So, saan nag-umpisa ang lahat? Pagka-graduate ko, sumulat ako ng libro. Ayan yung una ko sinulat na libro, Psych Nursing. Ang tito ko ang nag-mimeograph niyan, ang nag-sort niyan, ang nanay at tatay ko. Ganun nila ako sinuportahan noon. Nag-umpisa ako sa maliit, di ba? And then, eventually, naging author ako ng Mosby. And I was the first Filipino to author for Mosby Elsevier, the world's #1 publisher of healthcare publications. Binigyan pa ako ng Lord ng bonus. My book won in the International Book Awards in 2010, okay? Under the category Health and Medical References. Look, from this little thing to this one. Sabi nga nila, di ba, ito yung theme song ng mga ng mga nag-asawa, ng eventually, nung first honeymoon nila, okay? Ang theme song Great Things Starts from Small Beginning. Okay. May double meaning. Ano kaya yung small beginning sa honeymoon? Okay. Just to tell you guys, it takes a lot of effort to achieve one's dream. But it takes a single step. And that is to begin. To start. In Tagalog, kantayin natin. Magsimula ka, batiin ang kay gandang umaga, nang may ngiti sa iyong mga mata. Yan! So, sabihin nyo, yung mga magtatap ng board, ilagay nyo sa chat box natin, I will start now. Go! Thank you very much, Mary Ann. Nakaka-inspire daw. Totoo naman yon. I will start now. Go! Ayan. At wag mong kakalimutan ha, pag dumating yung panahon na nasa Amerika ka na, dinala ka na sa Amerika ng health carousel, paunahin mo muna yung pamilya mo. So ang una mong petition, ang parents. Okay? Diyan ako happy. Before my parents pass away, they know I carried out my role well. Okay? At minake sure ko, lahat ng kapatid ko, meron muna silang sarili-sariling mga bahay-bahay and before I took a look at, I took the time to take a look at what my needs are. So at this point in time, ano na lang ba ang kailangan ko? Ang kailangan ko, hindi para sa sarili ko, para sa inyong lahat. Kailangan ko makita lahat kayo maging RN. So ngayon pa lang, now, ilagay mo dyan sa chat box natin, RN ako. Come on, claim it. RN ako, ayan, nangunguna si Marilyn, si Dermy, si Kirby, ang dami-dami yung RN kayo. O, lahat tayo ha, huwag mangingimi. Ang mga taga-probinsya, may hidden talent yan, lalo na sa test taking. Tuturo ko sa inyo. Okay, so let's begin. Sabi nga nila, to be tested is good. The challenge life may be the best therapist. And look at this. Work hard, stay disciplined, and be patient. Your time will come. So ilagay nyo sa chat box natin, this is my time. Go! Ilagay nyo dyan, this is my time. Your time will come. This is my time. Okay. Yan. O, yung mga gustong mga mag-ham dyan na umaga, pwede mo sabihin, this is the moment. This is the time when I send all my doubts. Okay? Mamaya na yan. Bago tayo magkantahan, eto muna tayo. Dito muna tayo sa expectations natin for the day. So don't go to the test and harm. Be ready. Huwag mo sasabihin na, anyway, katabi ko naman yung jowa ko, madali lang naman mag-side glance sa papel niya. Oy, mahirap yan. Baka ma-headline ka. Tingnan mo to, ayaw magpakopya, binasag ang muka. Pasok! Huwag naman ganyan ang headline mo. Baka mamaya, binabasa na ni Mike Enriquez, okay? Yung news story na dahil sa nangyari sa'yo, okay? Huwag naman ganyan na binasag ang mukha dahil ayaw magpakopya. So, if you still are at a loss on what to study, okay? Let me just ask you to focus on the 3Ds. Pero, ano ang tanong? Oh, may tumatawa daw. OMG, natawa siya dun sa hindi nagpakopya, binasag ang mukha. Okay, go tayo. Ano ba yung 3Ds? Bago ko sabihin sa inyo ano yung 3Ds, okay, magsimula muna tayo dito. So first, I will address the question, what should be my framework for studying for the NLE? Ang dami-dami nagtatanong sa akin kahapon in a separate webinar, Sir Ray, what's your study habit? Paano mo nagagawa mag-aaral ng madami? Tapos nagagawa mong isiping simple lang siya. Well, the key is, kailangan may framework ka. Huwag sabog-sabog. Kasi ang gagawin mo, bubuksan mo yung notes mo. Ay, naku, hindi ko pala napag-aralan yung pharma, bubuksan mo na naman. Ay, naku, hindi ko pala napag-aralan yung psych, bubuksan mo naman. Tapos, nung nabuksan mo lahat yung notebook mo, sabi mo, grabe, ang dami ko pang aaralin. Tulog muna ako. Okay. So, ang unang-unang mong gagawin, dapat may disiplina. Sir, paano? Eto. Pag ako nag-aaral, ayoko ng magulo. Okay? So doon ako sa matahimik na lugar. Kaya may man cave ako lagi sa bahay hanggang ngayon. Tapos, pag inaantok ako, subconsciously, I remind myself, kailangan magising ako ng madaling araw. So magpiprepare ako ng snack, pero hindi ko kakainin. That is my motivation para magising sa madaling araw at yun ay mag-i-snack ako bago ako magbasa uli. Sabi nung estudyante sa akin nung nakaraang taon. Sir, alam mo, Sir Ray, ginawa ko yung sinuggest mo. Ano nangyari? Nag-prepare ako ng snack, tapos natulog ako, tapos gumising po ako, tapos kinain ko po yung snack, tapos natulog po uli ako. Ang ending daw, tumaba siya. Okay, wag ganon. Pag gumising ka, kinain mo yung snack, diretso aral na yon. So dapat umupo ka na dun sa pag-uupuan mo. Nag-prepare ka nga ng snack, kinain mo, natulog ka ulit at wala rin nangyari. Kidding aside, ano ba yung framework natin? This is the ground zero. When you're preparing for the boards, 7 days na lang. But take note, sir, may mangyayari ba in 7 days? Merong isa, okay, minentor ko, 7 araw lang, pumasa, okay? Maraming pwedeng mangyari in 7 days. Basta may disiplina. Okay. Ano framework natin? Nursing process. Pag sinabi nating nursing process, anong kailangan nating isipin? So the moment na nakita mo yung first question dun sa test paper mo, ask yourself, yung question ba ay nurse-centered? Kung nurse-centered yon, bring in the nursing process framework right away. The nursing process always begins with the assessment. So you will have to implement the process of elimination. Ano yung process of elimination? Eliminate mo na kaagad yung mga distractors doon sa options. Sabi nung isang estudyante sa akin, sir, ba't ganon? Pag nagtitest drill, ginagamit ko naman yung process of elimination. Pero Why do I always end up with the wrong answer? Well, that simply means you eliminated the correct answer. When you do the process of elimination, you make sure you do it properly. And let me teach you how. So when you examine the options based on the nursing process as a framework, ang unang-una mong titignan, yung bang options ay puro intervention or puro implementation. Pag ang pagpipilian mo, puro nursing actions, isa lang isipin mo, alin ang pinaka-safe na pwedeng gawin? Safety first. Then the second is, paano pag doon sa options, merong implementation, merong assessment. Then, choose assessment. At take note, you don't always find the word assessment sa board exam. Gumawa ako ng contextual analysis ng mga possible keywords na mga frequently ginagamit sa licensure exam. Parang ako lang yata yung may passion na gumagawa. I've been a reviewer in the local board since 1993. O diba? Sobrang mas matanda na yata yung aking review career kaysa sa majority of you. Okay. So, and I found out all throughout my experience na most of the questions, okay, ang sagot begins with 3 common words. CID, check, identify, determine. And these are rewordings of assessment. Maybe yung mga gumagawa ng tanong, subconsciously, hindi nila nakikita, they keep on repeating those keywords. Oops, hindi ko sinasabi na ang gagawin mo lang sa board exam, hanapin mo yung check, identify, determine. Tapos after 30 minutes, lalabas ka, sabi mo, sir, tapos na ako. Ang ginawa mo, basta lahat lang tinignan yung check, identify, determine, check, identify, determine. Naalala ko, may ganyan nung araw, nung CGFNS, minentor ko. Sabi niya after the test, sir, may tanong na, sir, may answer na ganito, sir, may answer na ganyan. Sabi ko, teka lang, ba't puro answer ang sinasabi mo sa akin? Ano yung mga tanong sa'yo? Sabi ba naman sa akin, sir, tinakpan ko. Ang binasa ko lang yung options. Pag nakita ko yung keywords na tinuro mo, yun ang pinili ko. But who can argue with what he did? He passed the test. That's a CGFNS test, the foreign test before the NCLEX. Tawa ako ng tawa. Pero nire-recommend ko ba sa inyo na gagawin nyo yun? Takpan mo yung tanong, tapos babasahin mo lang options kung ano yung may keywords yun ang pipiliin mo. Hindi ko nire-recommend yun. Pero ginawa yun ng isang minentor ko at pumasa siya. So who can argue with success? He passed the test. So let's move on. So, paano naman kung mixture ng physiologic and psychologic interventions ang mga options? All you have to do is think about Maslow. Sabi ni Maslow's hierarchy of needs, physiologic needs first. So, let's breathe life into that strategy. Useless yan pag hindi natin ginamit sa sample question. Here we go. A nurse enters the nursing diagnosis of impaired skin integrity related to improper positioning in a patient's chart. This will make the nurse and the hospital at risk for which type of tort. Unang-una munang kailangan tandaan mo dito, ano ba yung meaning ng word na tort? Yan ba yung talong na sinawsaw sa itlog at prinito? Torta yon, okay? When you say tort, okay, ito yung mga infractions or in Tagalog, pagkakamali. Okay. Pagkakamali that frequently leads to civil liability. So, ibig sabihin, may multa. Okay? A common example of a tort could be misdemeanor. Pag sinabi mong misdemeanor, this is a less serious form of felony. Okay? Hindi ka makukulong pag may misdemeanor. Example ng misdemeanor, petty theft. Yung tipong sumobra ang liquid paper sa ward nyo, inuwi mo. Okay? Magkano lang naman liquid paper, di ba? Petty theft. Or nag-vandal ka sa unit nyo. Pininturahan mo ng red mark. Okay? Na I will pass yung wall mo dun sa ospital. So vandalism is a form of misdemeanor. Or simply, you did not renew your PRC card. That is misdemeanor. Hindi ka naman makukulong. But definitely, you have an infraction. So it's a less serious form of felony. Now, let's move on to the two main things in options A and B. Ano ba difference pag sinabi nating negligence at malpractice? So in both instances, there's an act of commission or omission. May ginawa ka na hindi mo dapat gawin o may hindi ka ginawa na dapat mong gawin. Sa negligence, okay, ano ang kaibahan sa malpractice? Doon sa sino ang nag-commit ng infraction or mistake. Sa negligence, it is committed by a person with ordinary prudence, hindi professional. Sa malpractice, it is committed by a professional. That's why malpractice is professional negligence. Now, yung letter D, breach of confidentiality, an example of that is when you post on the door of the patient's room nakalagay, be careful, patient is blind. The diagnosis is there. That's supposed to be confidential information. When you do that, that's a breach of privacy. Now, in this case, what is the main subject of the question? We find it on the stem. You have impaired skin integrity related to improper positioning. The fact na naglagay ka ng improper positioning, ibig sabihin may pagkakamali. Pero yung nurse ang gumawa eh. The nurse is a professional. So you have professional negligence. Therefore, ang infraction mo ay malpractice. Okay? So yung mga sumagot ng letter B, you're on your way to topping the board. Okay, so everybody type it on our chat box. Say, I will top the board. Go! Ayan na, dumami. Nag-congest na. Ang daming gusto maging top-notchers. Okay? I would love to see you guys top the board. Lalo na yung parents nyo, no? Naalala ko tuloy ang nanay ko, paglabas ng result, takbo siya ng takbo, hinampas niya ako ng hinampas ng dyaryo. Pero, dahil nga wala kaming panghanda, ang pinanghanda lang niya, bumili siya ng calls. Alam mo yung calls, yung manok na mas matanda na sa 45 days at matigas na, yun lang kaya ng nanay ko eh. That was the time na ang bubong sa bahay ay tilon lang. At kung umulan, naipon yung tubig, tinutusok-tusok namin ng nanay ko hanggang sa nabasa kami. But you won't see my mom with negativity. She would always say, ano ba namang buhay ito? Tapos tatawa siya ng tatawa habang nababasa kami sa ulan. But that inspired me to give my mom yung isang bahay na matibay ang bubong. At happy ako na nagawa ko yun. And I'm sure kaya niyong gawin din yon. As nurses, Health Carousel will help you do that. So, let's move on to the next question. Which of the following data supports a nursing diagnosis of fluid volume deficit related to fever? So, this time, you're being asked to diagnose. And before you come up with your diagnosis, kailangan marunong ka na assessment. When you talk about fluid volume deficit, think of a dehydrated patient. So, pag may dehydrated patient, actually, nakalubog ang ating vein. So, walang neck vein distension. You have neck vein distension and fluid volume excess or congestive heart failure. So, we put an X. Urine-specific gravity of 1.030. Recall your normal values. Ang normal na urine-specific gravity, 1.010 to 1.025. If the specific gravity is less than 1.005, screen the patient for diabetes insipidus. If the specific gravity does not fluctuate, it doesn't go up, it doesn't go down, fixed lang siya, patient should be screened for renal failure. But if the specific gravity goes beyond 1.025, then that simply means the patient could be having concentrated urine, typical of clients who are dehydrated. So we put a check on letter B. Temperature of 102 degrees Fahrenheit, that's an elevation from the normal, which is 37.5. This is typical of patients who are dehydrated. So once again, we put a check. Moist cough is found in patient with fluid volume excess, like in patients with pulmonary edema, congestive heart failure. So we put an X. Flushed dry skin is typical in patients with dehydration. We put a check. Heart rate of 56 beats per minute. Now take note, when the patient is dehydrated, the heart usually compensates. So you have compensatory tachycardia. What we have here, 56 beats per minute, is less than 60, which is the minimum normal heart rate. So this is indicative of bradycardia. So this is not typical. We put an X. Way to go. Let's move on. So what about kung ang tanong naman ay ganito? Which of the following is an example of a diagnostic nursing intervention? You go with the word diagnostic. Once again, before you come up with your nursing diagnosis, you need to assess. So pag sinabing diagnostic nursing intervention, look for an answer that gives you the hint that it's about assessment. Okay? So pag diagnostic nursing intervention, look for assessment. Ano sabi natin? Assessment could be reworded with the words check, identify, determine. O nasan dyan ngayon? Sige, sulat nyo dyan sa inyong chat box. Ano ang tamang sagot? O, tignan mo. Hindi pa nila nabasa yung buong option, may sagot sila. Letter C. Tapos pag tinanong mo, bakit yung C ang sagot? Kasi sir, check. I'm trying to teach you how to be street smart. I tell you, walang librong magsasabi sa'yo niyan. Kasi nga, sabi ko, in my 25 years of mentoring students, okay, marami ako napag-top ng board na minsan nagtataka yung school, bakit naging top-notcher yan? Marunong sila maging street smart. Okay, let's move on. Which of the following is an example of an interdependent or collaborative intervention? Ngayon, pag sinabi natin interdependent, most of our functions as nurses are independent functions. Isa lang ang namumukod tangi na interdependent, and that is administration of medication because you need a doctor's order. So pag nakita mo yung interdependent, look for medication administration. So ano sagot natin ngayon dito? Interdependent? Very good. That is option A. Okay, ngayon, paliwanag ko. Sir, bakit hindi B? Bringing the client to the laboratory is an independent intervention. Sir, bakit hindi C? Referring the act of referring, sino ba ang gagawa ng referral? Sino ba ang magdidesisyon na magre-refer ka? Ikaw. Di ba? O, bakit mo i-refer yung pasyente sa doktor? Kasi may komplikasyon. Ikaw ang nagdidesisyon. So that's independent. Okay? Writing a care plan is also independent. So, once again, pag nakita mo yung independent, look for the drugs. Okay? Let's move on. Dito na tayo sa pinakihintay niyong 3Ds. Okay. Ano ba ibig sabihin ng 3Ds natin? Sabi ng isa, sir, yan ba yung team dugyot, team dulpot? Okay, let's move on. The first D would be drugs. Okay? So, in essence, ang mahirap kasi kailangan pag-aralan mo yung drug sa MCN, drug sa PEDYA, drug sa MS, drug sa Psych. Napakadami. Let me simplify that for you. Kaya ka naguguluhan, wala ka kasi minsan framework. The framework would always give you a sense of direction. Ito yung finormulate kong framework for studying about drugs. How to predict what concepts to focus on pharmacology? I call it the check framework. Ano yung check framework? Yung 5 bagay na kailangan malaman mo bawat isang gamot pag ikaw magbo-board exam na. C means classification of the drug. Example, you met the drug Valium or diazepam. Ano ba yon? Sedative, hypnotic. Okay, so that's a classification. It could also be used as anti-anxiety. That's the first thing na kailangan mong tandaan. Second, how will you know that the drug is effective? Okay, so Valium or diazepam can promote sleep, can relax the muscles. Okay, so it could be given in clients with muscle spasms, those who are in traction with muscle spasms. It could be given in clients who are being prepared for surgery. Okay. Next, exactly what time do you have to give it? Remember the functional concept, okay? All anti-anxiety medications are best given before meals because food in the stomach delays absorption. So, anti-anxiety ang diazepam, when is the best time to give it? It's before meals. Ganun lang yon. Next, C, client teaching tips. Knowing that the drug could cause sedation, so therefore it could lead to drowsiness. So what do you teach the patient? Ask for assistance when they go to the bathroom because they are at risk for falls. And finally, kiss to giving it safely. Pag sinabing kiss to giving it safely, ano imo-monitor mo? So, your sedatives could cause respiratory depression. So, anong priority mo? Monitor the respiratory rate. See, bawat isang gamot, 5 lang ang kailangan mong malaman. Diba? So, always check your medication. Yan, ang secret number 1, first D. Okay, now, ang tanong, sir, ano namang mga gamot ang ire-recommenda mong kailangan namin pag-aralan? Kung ako ang magbo-board exam ngayon, here are my top picks. Kaya ginawa kong topics for drugs. Number 3, vitamin K. Okay. Now, let's check vitamin K. Vitamin K is a fat-soluble vitamin. How will you know that it's effective? There will be no excessive bleeding in the newborn. So it's given to prevent bleeding. It is given IM to newborns after birth. But now, parents could actually decide whether this should be given IM or otherwise. Okay, so client teaching tips. If parents refuse the IM route, 2 oral doses of 2 milligrams are given. The first dose within 6 hours of birth, so that's day 1. Second dose between 4 to 7 days, that's week 1. And a third dose could be administered at approximately 1 month of age. In essence, ang tatandaan mo lang, pag vitamin K, kung 3 doses ibibigay, yung first one binibigay at day 1 within 4-6 hours after birth, then yung second dose, week 1, and then yung third dose, month 1. Okay? So day, week, and month. Ganun lang yon. Now take note. If the baby vomits within 1 hour of administration, administer another dose. Now here's a functional concept. Vitamin K is given to the newborn to facilitate clotting and prevent bleeding. But it is not for the purpose of stopping hemorrhage. Vitamin K will not stop hemorrhage. Sir, may natural vitamin K ba? Green leafy vegetables. Okay. Like kangkong, may green leafy vegetables yan. Okay, green leafy vegetables yan. Ngayon, yung may vitamin K na green leafy vegetables would help generate natural vitamin K. Pero since yung bata nga, sterile pa yung GIT, wala pa siyang vitamin K producing bacteria. Kaya binibigyan siya ng vitamin K. Therefore, let's try to use that functional concept to answer a question. Which of the following statements about vitamin K in the newborn is not true? A, it prevents bleeding. That's true. B, it can be administered orally. That's true. C, parents have to be consulted for the route of administration. That's true. D, it is given to stop hemorrhage. Okay. No, naa. Kaya lang, minsan due to anxiety, yung ibang nagtitake ng board, pag nakita na yung bleeding and hemorrhage, nalito na. Okay? So this is just a matter of comprehension. Okay, relax. Take a deep breath. Okay? If you think nagugulumihanan ka, huwag mong pilitin ang sarili mo. Number 2, magnesium sulfate. Okay. So, let's check magnesium sulfate. First, ano ang classification? It's an anticonvulsant. It also has a laxative effect. It's a tocolytic. Ano daw yung tocolytic? Sa aming mga Ilocano, ano daw yung tocolytic? Sabi ng isang estudyante ko, it removes the tukol. Tocolytic removes the tukol. No, a tocolytic is a medication that relaxes the uterus. Okay, so in essence, it helps prevent preterm delivery. Okay, so how will you know that it's effective? No convulsions, no preterm labor. Exactly what time do you have to administer it? Administer it based on how the doctor prescribes it. Now, a common side effect is diarrhea. Now, always remember that there's always a risk for magnesium sulfate toxicity, so you need to keep the antidote, calcium gluconate, at the bedside of the patient. And then, if you are giving magnesium sulfate, you need to assess the patient for 4 things. Ano-ano ba yung kailangan mong i-assess? So first and foremost, remember the code for what you will assess. It's BURP. Okay, so B, that's going to be blood pressure. U, urine output, it should be at least 30. R, respiratory rate, okay, should be at least 12. And P, patellar reflex or deep tendon reflex, 2+ is normal, okay. Then your 3+ could be abnormal or normal. 4+ indicates clonus and is always abnormal. So dapat yung patellar reflex mo, which is your knee-jerk reaction, okay, which simply means that pag in-struck yung knees ng percussion hammer, there's usually leg extension. Dapat yung reaction mo ay at the 2+ level. Okay? So once na nakita mo na reactive yung pasyente, that simply means na yung patient natin ay wala pang magnesium sulfate toxicity. Sir, paano pag ang blood pressure nag-fluctuate? Ang urine output mababa sa 30, ang RR mababa sa 12, yung patellar reflex na depressed. So it simply means you need to check the level of magnesium sulfate. Therapeutic level is 3.5 to 7 milliequivalent per liter. So therefore, anong kailangan nating tandaan dito? If you'll be asked, what's the priority for you to check? Check the respiratory rate because that is very indicative of magnesium sulfate toxicity. So if the respiratory rate goes less than 12, suspect respiratory depression. If it goes higher than 25, then suspect pulmonary edema. So whether the RR goes down or it goes up, you need to refer the patient to the physician. Okay? So using now your check facts, okay, related to mag sulfate, let's use these things to answer a question. Which of the following patient data should be the priority when evaluating the effects of magnesium sulfate? I just told you about this a while back, and I know for a fact that you know the answer. Everybody, sabi niya, wow, sir, pinapadali mo mag-aaral. Salamat! Okay, yun naman yung mission ko. Okay, transfer ko sa inyo yung alam ko para pagdating ng panahon na kayo na yung nagsasalita like me, you do it right. Okay? Okay, so very good. Parang lahat yata to mag-board top notcher eh. Naku, problema yung mga mag-check ng mga papel nyo. Excellent, kasi below 12 tayo. Ang galing. And of course, my top pick for drugs. Ang walang kamatayan. Lithium. Now take note. Lithium is originally considered as a salt substitute. It's a drug of choice for bipolar 1 disorder. However, may characteristic ang lithium na slow-acting siya. So pag binigay mo sa pasyente ngayon ang lithium, wala pang epekto yan. It will take 1 to 2 weeks or 7 to 10 days bago may epekto yan. So, pwede mo ba siyang gamitin sa acute mania? Hindi, kasi slow-acting ang lithium. That's why the drug of choice for acute mania would be antipsychotics. So is it all right to combine antipsychotics with lithium? Yes. And what's the rationale? Your antipsychotic will manage the symptoms of mania until lithium takes effect. Since ang lithium, 1 o 2 linggo bago umepekto, antipsychotic muna. So sabay mong ibibigay yan para pag umepekto na ang lithium after 2 weeks, pwede mo nang tigilan yung antipsychotic. So pag ang tanong, the drug of choice for acute mania, antipsychotic dapat. But the drug of choice for maintenance therapy for bipolar disorder, that's going to be lithium. Okay, so let's move on. Let's check lithium carbonate. The most important thing na kailangan mong tandaan ay ano ba ang therapeutic level ng lithium? Pinaka-importante yon. Ang sagot ko, depende. Depende sa answer. Dalawang factor. Age of the patient and the phase of therapy. Kasi meron tayong tinatawag na elderly value. Sa elderly, lithium should not exceed more than 1.0 milliequivalent per liter. Pag sa adult naman, below 65 years old, dapat alamin mo kung nasa acute phase ka ba, which is the first 3 months of therapy, or nasa maintenance phase ka ba, beyond 3 months of therapy. Sa first 3 months of therapy, weekly usually chine-check ang lithium level. So blood is obtained 12 hours after the patient's last dose or lithium or before breakfast. Now, after the first 3 months, every 3 months na lang siya pag maintenance therapy, nag-check ng lithium level. Okay, now, paano natin to ima-match? Adult acute phase, pag acute phase, mas mataas. So 0.5 to 1.5 milliequivalent per liter, that's D. Pag neurotoxic level, this is evident pag may lithium level ka na 2.0, so letter B. Pag elderly therapeutic level, it should not exceed 1.0. At pag maintenance level na sa adult, 0.5 to 1.2. Mas mababa na ang maintenance level. Okay? Now remember, lithium is a salt. So kailangan i-combine mo siya with sodium. So you have to give a high sodium diet and high fluids diet to facilitate lithium excretion exclusively by the kidneys. So pag ang pasyente may kidney failure, di siya pwedeng bigyan ng lithium kasi hindi niya yun mai-excrete. Magli-lithium toxicity siya. So eventually, magdadialysis yung pasyente mo kahit na moderate lang ang lithium toxic levels na nandoon sa kanyang katawan. So always remember this functional concept. A safe blood level of lithium is 0.6 to 1.2 milliequivalent per liter. Lithium toxicity can happen at level 1.5. Sir, paano pag 1.5? Can we consider na lithium toxicity yon? Pag may severe GI symptoms, severe nausea, severe vomiting. And take note, take a look at the tremors that the patient is experiencing. Okay? So severe lithium toxicity happens at level 2.0. Lithium level at 3.0 and higher are considered a medical emergency. So summarize natin lahat ng pinagdadadaldal ko. Nasa handout to, you don't have to copy it. Just listen to me at the moment. Pag below 65 ang pasyente natin, acute dose 0.5 to 1.5, maintenance 0.5 to 1.2. Your priority is to monitor serum levels. For therapeutic levels for 65 years old and above, the elderly, acute dose 0.6 to 1, maintenance dose 0.4 to 0.8. Tatandaan mo lang, basta elderly, it should not exceed 1.0. Once again, priority, monitor serum levels. If you have levels of 2 to 2.9, increase fluids, and this is moderate toxicity, prepare the patient for hemodialysis. Pag 3.0 and above, the patient could go into neurotoxic situation, and then the patient would manifest symptoms of dementia, dysarthria, okay, and delirium. So you need to implement emergency interventions. And take note, for lithium toxicity, the antidote could be mannitol or diamox. These drugs will promote the excretion of lithium. Now, remember that some foods and drinks may affect lithium levels in the body, like salt, caffeine, and alcohol. And let me summarize, ano ba yung mga factors that affects lithium level? Ang code natin, CHAD was SAD. So CHAD, caffeine, tea, hormonal fluctuations, antihypertensives, diseases of the heart and the kidney. Was weight loss or gain, amount of fluids like dehydration, seasonal changes. So lithium levels may be higher in summer. Or SAD, sodium in the diet, activity, diuretics, and ibuprofen. So ang code, CHAD was SAD. So remember, what is the most common cause of lithium accumulation? Sodium depletion. So you always have to ensure, this is a nursing priority, that the patient has adequate or high sodium diet. Pag sinabing adequate sodium, 3 grams yon. Pag sinabing high sodium, 6 to 10 grams of sodium in the diet. Yan ang diet ng pasyente na nagtitake ng lithium. At huwag mong paglalaruin yan under the sun. Kasi pag pinagpawisan, you lose sodium on your skin. That's the reason why this patient would eventually, ano nangyayari sa pasyente? Pag pinagpawisan ka, you lose sodium. So at risk ka na sa lithium toxicity. Pagkapi ka ng kapi, ihi ka ng ihi. So you lose water. Wala na magdadilute ng lithium. So at risk ka sa lithium toxicity. Okay? And what is difficult with lithium toxicity is that the universal antidote, activated charcoal, doesn't work for lithium. Okay? Now, when do we say that there's mild to moderate lithium toxicity? When there is, initially, it begins with GI symptoms, di ba? Diarrhea, vomiting, tremors, fine muscle weakness, and drowsiness. Now, take note. Take note of the tremors. Pag mild toxicity lang yan, it begins with fine tremors. Pag yung fine tremors, naging coarse tremors, tumaas na ang lithium level mo. So how would you know that the patient's having lithium toxicity? Fine hand tremors that progresses to coarse tremors. So tatandaan, pag fine tremors lang, sir, correct? Mali. Kasi pag fine tremors lang, that's typical of hyperthyroidism. Pag coarse tremors lang, sir, nasa option mali? Mali. Kasi coarse tremors is typical of alcoholic withdrawal, like delirium tremens. Diba? Pag flapping tremors, hepatic encephalopathy. Pag pill rolling tremors, Parkinson's disease. Pag intentional tremors, multiple sclerosis. You have to know your differential diagnosis. Tremors, tremors. Tremors in bed, masturbation. Wag na yon. Okay. Now, tatandaan mo, pag lithium toxicity, fine hand tremors, that progresses to coarse hand tremors. And then the patient will have muscle weakness and drowsiness. So remember this. Mild lithium toxicity will usually go away even without treatment for as long as you instruct the client to stop taking the lithium and increase fluid intake. So what's your priority for mild lithium toxicity? Instruct the patient to stop taking lithium and increase fluid intake. Now, how do we know that there's moderate lithium toxicity treatment? So usually this involves stomach pumping or gastric lavage, bowel irrigation, administration of fluids, hemodialysis, and of course, you need to monitor the vital signs. In severe lithium toxicity, always remember this functional concept. Everything goes up except the BP. Okay, so in severe lithium toxicity, temperature goes up, so hyperthermia. Okay, the pulse rate goes up, so you have rapid heartbeat, but the BP goes down, so you have hypotension. So what are the symptoms? Hyperthermia, seizure, slurred speech, rapid heartbeat, and low blood pressure. Okay, so poor coordination occurs at lithium level 1.5 to 2 milliequivalent per liter. Next, remember this, ataxia occurs at lithium level of 2.0. Ano daw ba yung ataxia? Yung ba sir, yung sinugod siya? Ataxia? Ataxia means uncoordinated movement. It is indicative of neurotoxicity. Okay, remember what I'm trying to tell you a while back? Fine hand tremors, okay, occur at a therapeutic lithium level, while coarse hand tremors occur at toxic levels. So fine hand tremors that progresses to coarse hand tremors is indicative of development of lithium toxicity. With that knowledge now, let's try to answer a sample question. Paano pag sata yung tanong? Yan. Which of the following statements is true regarding lithium? Select all that apply. It is not indicated for acute mania. Yes, because it's slow acting. We answered that a while back. The therapeutic level depends on the client's age. Yes, iba pag elderly, not more than one. Okay? A diet of high sodium and high fluid is needed. Yes. It is contraindicated in clients with disorders of the kidneys, the heart, and the thyroid. Yes. Neurotoxicity occurs at level 2.0. Yes. Look at letter F. It should not be given with antipsychotics. What did I tell you a while back? Top-notchers and passers. It should be given kasi lithium is slow acting. So this is an X. Okay. So those of you who may want to eventually go through some more of my videos, I've been uploading my videos at Gapos Mentors. Those who have yet to click the subscribe and bell notification button, please do so that you top the board. But those who will share it to at least 10 of their friends will top the board and eventually pass the board with rating of more than 80. Oh, diba? So you can share and our videos so we can help other nurses as well. Reach their dream. Okay, sabi ni Rama Barahim, yes sir. Go, go, go tayo. Ano na yung second D? Ang second D ay diagnostic and therapeutic procedures. Sasabihin nyo na naman, ang dami niyan, sir. Anong pag-aaralan ko sa diagnostic and therapeutic procedures? Padadaliin natin. Ang framework mo naman sa diagnostic and therapeutic procedures ay 3 P. The first P, at ito ang dapat mong unang malaman, ang aaralin mo when it comes to procedure, ano ang purpose? Para saan yan? Second, how do you prepare the patient? And third, post-procedure complications. Halimbawa, if the patient, for example, underwent catheterization, tapos eventually, pagtanggal ng catheter, nagkaroon siya ng bladder distension. So ano yung complication? Okay? So, pag nagkaroon ng bladder distension yung pasyente, your priority should be to assess, okay, the lower abdominal area, kung merong bulging, at kung meron nga, ibig sabihin, nag-develop siya ng urinary retention. The next question is, bakit kaya? Okay? So there are only 3 things that you have to know. Kanina sa medication, 5 kailangan mo malaman. Dito sa procedure, 3 lang. 3 P. Purpose, how do you prepare the patient? Post-procedure complication. Sabi nila, yes, nag-i-enjoy sila. Salamat, natututo kayo. Okay? So you know, kulang na kulang lang talaga minsan ako sa oras. The other day, I was like mentoring somebody else who's taking the international exams. And then we really spent almost the day trying to fix everything for her. And then she took the test the next day. After 2 days, she received the result and she passed. Ang kailangan mo lang, organize yung nasa utak mo. Huwag kang papaapekto sa chismis. Kasi pag naka-apektuhan ka ng chismis kung ano ang aaralin, magka-cram ka. Sabi ko nga, yung ating tinidiscuss ngayon, hindi ko lang naman basta inimbento or napanaginipan yan. Sabi ko, life ko na, yung for the past more than 25 years, pinag-aaralan ko kung ano yung nangyayari sa mga nursing exams. Wow, si John Peter, alam niya ang COTI, Catheter-Associated Urinary Tract Infection. Naalala ko tuloy isang estudyante, sabi niya, Catheter-Associated Urinary Throat Infection. Urinary throat infection. Sabi ni Rama, napakadali maintindihan, sir. Thank you so much. Maraming salamat. Okay? Number 3. Okay? Sa ating top pick sa procedure, non-stress test. Laging nalilito ang mga estudyante, ano ang difference ng non-stress test sa contraction stress test? Well, yung difference niyan sa tatlong aspekto. Number 1, sa purpose. Non-stress test is used to determine fetal well-being, kung yung fetus ba ay reactive. Contraction stress test is used to determine if the fetus can withstand uterine contraction during the labor process. Okay? Next na difference. Non-stress test correlates fetal movement with fetal heart rate. Ano ibig sabihin nun, sir? Ang chine-check ng non-stress test, kung bibilis ang pintig ng puso ng bata pag siya ay gumalaw. So it's a test for fetal heart rate acceleration. Ang mini-measure niya, pagbilis ng pintig ng puso. Sir, ilan ba dapat yung pagbilis? Minimum of 15 beats per minute above baseline at least twice within a 5-minute period. So ibig sabihin nun, sir, pag chinek ko, dapat yung heartbeat ng bata, dapat may baseline ako. O kunwari, nung hindi gumagalaw yung bata, 140 ang fetal heart rate. Pinakain mo yung nanay, nag-react yung bata, gumalaw. Okay? O kaya niring mo yung bell, nag-react yung bata, gumalaw. I-check mo uli ang heart rate. Pag yung heart rate naging 165, wow, from 140 to 165, so 25 yun. More than 15 beats per minute. Twice yun nangyari in 5 minutes. You have a positive non-stress test. So what does a positive non-stress test tell us? It simply tells us that the baby is okay. Tatanda mo yung triple R. Reactive result, okay, means baby is real good. Reactive result means baby is real good. Now, that's the non-stress test. Paano yung contraction stress test? So, to differentiate, contraction stress test correlates fetal heart rate with uterine contraction. Ano ang mini-measure mo? Ano ang tinitignan mo? Yung pagbaba ng fetal heart rate. So, ang contraction stress test is a test for fetal heart rate deceleration, pagbagal. Ang tanong, sir, lahat ba yung pagbagal ng fetal heart rate abnormal? Hindi. Ang early deceleration, the type na pagbagal that occurs early in a contraction is normal because it indicates head compression. Diba? Lagi ko ang sinasabi sa mga estudyante ko, ang lahat ng ulo na pumapasok sa cervix na iipit. Kaya yung early deceleration, it represents head contraction. Okay? Now, next important thing na kailangan nating tandaan, okay? Your contraction stress test, if it is positive, it means the baby is in a dangerous situation. So what indicates a healthy baby? Positive non-stress test. What indicates a baby that is not healthy? Positive contraction stress test. Let's take a look at the differences. This is what I'm trying to tell you. Non-stress test assesses fetal well-being. Contraction stress test assesses the ability of the fetus to withstand labor process. Non-stress test correlates fetal heart rate with fetal movement. Contraction stress test correlates fetal heart rate with uterine contraction. Non-stress test positive result indicates baby is okay and reactive. Contraction stress test positive result may indicate the baby is in a dangerous situation. Now, what are the functional concepts? Non-stress test may be done after age 26 to 28 weeks of pregnancy. Non-stress test may take about 20 minutes. And what do we tell the patient? You will lie down with 2 belts around your belly. One measures the baby's heartbeat and the other measures the contractions. So instruct the patient, press the button when you feel your baby kick or move. Using the knowledge now that we learned, let's answer a question. A result that indicates fetal well-being, that's a key phrase, fetal well-being, with no signs of fetal distress. Okay, tandaan mo. Late deceleration and variable deceleration may indicate fetal distress. Early deceleration indicates head compression. Late deceleration indicates placental insufficiency. Variable deceleration indicates cord compression. Now, tignan natin ngayon dito. Ang hirap niyan, sir, nabubisit ako pag ganyan ang exam, chicken and feather. No. Okay, this is just clustering of concept. Ano sabi natin? Okay, yes, Mark, you're right. Veal chop. Okay, pero mas nakakalito pa yung veal chop. Okay, compare mo na lang yung dalawa. When you have a positive non-stress test, the baby is okay. So definitely, ang sagot dyan kasama ang number 1. So ilang options lang may number 1? A and C. So ang pagpipilian mo, A and C lang. Look at letter A, 1 and 2. Yung number 2, positive contraction stress test, ibig sabihin nun, pag positive ang contraction stress test, the baby is in a dangerous situation, may deceleration. So definitely A, cross it out. So that makes you now, okay, you should only focus on 1 and 4, which is letter C. See? You do the process of elimination because number 4, negative contraction stress test means walang deceleration. And the baby is okay. So what's my pick number 2? CPR. Alam ko memorize niyo yan, 1 and 2 and 3, di ba? Okay. Okay, minsan nga, pag nag-CPR, mahirap yan pag-aralan kasi procedural yan eh. Kaya ako, i-recommend ko, manood ka ng video ng American Heart Association para mas matandaan mo. Kaya lang, paano kung ang lumabas sa board exam ay CPR in pregnant clients? Di ba? Minsan sabi mo, ano ba yun? Yung pinag-aralan ko, parang ako yan, nag-create ako ng mga notes ko for the boards. Eh. Lahat ng mga laws, okay, sinulat-sulat ko, naka 7 pages ako. Everyday nagme-memorize ako ng 5 laws. Nung mag-board exam na ako, isa lang ang lumabas na law, yung hindi ko pa alam. Frustrated ako kasi ang biglang lumabas ay yung provision ng Constitution on health of the citizenry. Malay ko ba? Puro Republic Act ang inaral ko. O, kaya minsan, frustrating talaga. Given yon. It's your attitude that separates a winner from a loser. How you look at situations. Kung hindi mo masagot, forgive yourself. Hindi yung pinipiga mo yung sarili mo. Don't be so focused on earning those numbers. At the end of the day, what makes a good nurse is determined by what is in the heart. Not just what's in here. Okay? So, forgive yourself pag meron ka nakalimutan na isang bagay, ha? Sabi nga nila, students study because they want to be perfect at what they do. But since nobody is perfect, why study? That's another way of looking at it. Okay? So, CPR in a pregnant client. Like, for example, you are given this question. The nurse is providing discharge instruction to a pregnant client after prenatal checkup. Which of the following instructions will the nurse need to provide the client to decrease the risk of complications associated with motor vehicular accident during pregnancy? Yung ganyang mga tanong, nag-motor vehicular accident, so may kailangan kang tandaan. So, let's call in functional concepts. First and foremost, when trauma occurs, your priority should be check the fetal heart rate and then monitor the contractions. If within the first hour after trauma, there is 3 to 7 contractions, let the patient stay in the hospital for 24 hours, monitor. And then, kung hindi naman nag-progress, discharge after. Ngayon, what do you tell the patient on discharge? They need to wear the seat belt, okay, on the lap belt and across the belly, okay? No matter how short, okay, will they be driving their vehicles. Kahit na 3 minutes lang magdadrive, they have to wear the seat belt. And they have to turn the airbag sign on. Okay? Hindi yung nag-seatbelt nga, hindi naman tinurn yung airbag. So, chance kasi noon, pag nabangga siya, yung tiyan niya, mauuntog sa manibela. So, that results to trauma. At pag nagkaroon ng trauma, ano ang common complication? Abruptio placenta. At pag nag-abruptio placenta, may dark red vaginal bleeding, so you have to prepare the patient for ultrasound. That's the diagnostic test of choice for bleeding disorders of pregnancy. Now, to perform CPR in a pregnant client, put the patient on the left lateral uterine displacement is required. And you have to turn the patient, okay, 25 to 30 degrees yung kanyang katawan. So ganito, ayan, left lateral uterine displacement, you tilt the pregnant woman's body 25 to 30 degrees. Okay, or you do manual uterine displacement. Using those knowledge we learned, let's go back to the options. Select all that apply. Always wear the seatbelt while driving with, eto ang mali dito. Okay, yung airbag sign off. Okay, remember, if sabi natin dapat on ito. If a part of a possible answer is wrong, the entire option becomes wrong. So we put an X. Assessment of fetal well-being must be done after accident. Yes. Prepare for ultrasound. Yes. Request for discharge if there are 3 contractions in 1 hour after accident. No, we said confine the patient for 24 hours and monitor. So that's an X. Keep the client flat for CPR. Once again, no. You tilt the body 25 to 30 degrees. Report dark red painful vaginal bleeding. Yes, that's indicative of abruptio placenta. My number 1 top pick for procedures, definitely electroconvulsive therapy. Now, this was initially utilized by Ugo Cerletti and Luciano Bini, 2 Italian psychiatrists, take note, to treat either acute mania, catatonic schizophrenia, and depression. But eventually, it was considered as the treatment of choice for depression. The exact mechanism of action is not known. However, listen up, okay? When a patient undergoes ECT, they have to have 6 to 12 treatments. Usually more than 12 treatments could lead to permanent loss of memory. So you cannot have ECT every day. There has to be an interval of 24 hours in between. There are 3 drugs that should be given. Okay, your atropine sulfate to decrease secretion, prevent aspiration. Okay, your methohexital sodium, okay, which relaxes the muscles, and your succinylcholine or anectin, which is an anesthetic agent, okay, pre-anesthetic agent. Now, your anectin could potentially relax the respiratory muscles. That's why your priority after ECT is to orient the patient, because there's temporary memory loss, and monitor the heart rate because of the drug succinylcholine or anectin. Now, there is only one absolute contraindication to ECT, and that's any condition that increases the intracranial pressure. So which means if you have cerebral hemorrhage, if you have brain tumor, if you have glioblastoma multiformes, then the patient should not undergo ECT. But pregnant patients can undergo ECT. Those with history of MI can undergo ECT. Those with history of fracture can undergo ECT. Question: who should sign the consent of the patient? Usually, ECT will have a pre-ECT admission consent form, and it's the patient who should sign the consent. Okay, now, having that in mind, so always remember that ECT is the most effective and evidence-based brain stimulation technique. The absolute contraindication are conditions that could cause increased intracranial pressure. So let's answer this question. Which of the following statements is true regarding ECT? Most patients need 6 to 12 treatment. Yes. 4 to 20 for severe depression. That's yes. Will involve EEG, ECG, pulse oximetry. Yes, before the procedure. Propofol or methohexital will be administered. Yes, that's to induce sleep and to relax the muscles of the patient. Succinylcholine, a muscle relaxant or a pre-anesthetic agent, is also administered. Yes. Improvement is noticeable after a week. Yes, or after 2 to 4 treatments. And it is an invasive procedure? No. It is considered a non-invasive procedure. So complications of ECT may include BP fluctuation, and the most common is headache. The second most common is temporary memory loss, confusion, poor concentration, and pain and discomfort. Now, let's compare ECT with repetitive transcranial magnetic scan. ECT involves causing seizure using electricity. RTMS involves the use of electromagnetic scan. The disadvantage of ECT is that it cannot target specific parts of the brain and it requires sedation. Your RTMS can target specific parts of the brain and no sedation is required. So this is how your RTMS is done. So the scanning is done for each part of the brain to stimulate neuronal activity. So RTMS is used to treat depression and anxiety. It's recommended when medications and psychotherapy fail to work. So RTMS is an alternative to ECT when the patient is unable to tolerate anesthesia or they have higher risk for seizures. Now, what are the complications of RTMS? Similar to that of ECT, patient will have mild headache, lightheadedness, but this time they won't have memory loss. They will have temporary hearing problems and a tingling in the face, jaw, or scalp. Okay, so let me read to you a feedback that we have from in our YouTube channel from Kathleen Villarde. You did everything to make it fun and exciting. I learned so much from you, Sir Ray. Thank you. You're amazing. Sending my gratitude from Zamboanga City. Maraming salamat po sa ating mga nurses dyan sa Zamboanga. Okay? Dapat ganito yung attitude natin. We have to learn how to be grateful. Sabi nga nila sa heaven daw, yung room for request, 24/7 punong-puno. Pero yung gratitude room, isa lang ang angel, wala pa halos phone call. So once we get what we want, we always have to say thank you. Okay? Okay, put that now in our chat box. Say, thank you, I will tap the board. Go! Thank you, I will tap the board. Yan. That's the attitude. You always have to be learn how to be grateful. Thank you, I will tap the board. Kailangan may I will tap the board. You have to claim it. Go, go, go. Ayan, dami-dami. Okay. May nare-receive ako message sa email ko. Sabi ba naman, sir, akala ko alas 10 pa. Ano? Alam mo, minsan yun ang problema ng mga Gen Zers or millennials. Dahil last time, alas 10 tayo nag-umpisa. Now, they assume alas 10 uli. Okay. That's one thing that you have to avoid sa board exam, ha? You always read the instructions first, okay? Para hindi ka mawala. Okay. So, once again, those friends of you na akala alas 10 pa, nandito na po tayo. What's the third D? The third D definitely would be diseases. Mahirap aralin yan. Kung wala kang framework, nag-start tayo sa framework, so there are only 5 areas that you need to focus on pag nag-aaral ka sa mga sakit. And my framework, mild PI. Nabahala ka na, ano ibig sabihin ng PI sa'yo? Mild PI. M, you have to know the main problem, the pathophysiology. Like in patients with asthma, what causes the wheezing? Okay, it's due to the inflammatory reactions of the layers of the internal lining of the airways that leads to narrowing. That's why you have wheezing. Okay, next, the initial and other symptoms. Like for example, in congestive heart failure, pag left-sided, what is the initial sign? Cough or moist cough. Okay, pag right-sided, what is the initial sign? Neck vein distension or jugular vein distension. Okay, laboratory data, for example, if you had COVID, okay, what would tell you that the patient's developing MI, DVT, or stroke? Your D-dimer. Okay, like for example, if your patient has diabetes insipidus, what do you need to check? The urine specific gravity. If it goes down, it simply means that the patient is unable to concentrate urine. Then the diagnosis, specifically your nursing diagnosis. So what is your priority nursing diagnosis? So if your patient has COPD, ineffective breathing pattern. And after that, PI, priority interventions. Like for example, in a patient with MI, what is your priority intervention? To administer oxygen so that you facilitate aerobic metabolism and you decrease anaerobic metabolism. So those are the things that you have to remember. Mild PI. Okay. So, sir, anong mga top picks mo for diseases? Kung ako mag-aaral ngayon, number 3 on my list, schizophrenia. Sabi nila kung ano daw yung master mo, eventually yung sakit mo. O hindi, I beg to disagree. That's my major in my master's degree, okay? Mental health and psychiatric nursing, okay? And I teach mental health and psychiatric nursing at the graduate level. Okay, ngayon, ang tanong, okay, sir, anong pag-aaralan ko sa schizophrenia? O yung mga medyo old na graduate na nandito ngayon. Yung schizophrenia po dati, may 5 subclassifications, di ba? Catatonic, disorganized, paranoid, o di ba? Kino-compare, contrast pa natin yan. Undifferentiated. Ngayon, pinag-isa na lang yan sa DSM-5. Pag sinabi schizophrenia, isa na lang. Wala na siyang subtype. Now, the main problem in schizophrenia, apply natin yung mild PI, would be an excess in dopamine. The initial manifestation could be personality changes. Laboratory data, well, the patient will have to be assessed physically, and then eventually, sa kanilang brain, manonote sa CT scan that there are areas of atrophy. Okay? So what would be your nursing diagnosis? Altered thought process is the main nursing diagnosis. And then priority intervention, present reality. How? You have to differentiate objective reality from subjective reality. So anong difference nun? Objective reality is what is real to normal persons like the nurse, if we are normal. Subjective reality is what is real for the patient. Okay, so if the patient says, I'm hearing voices, what do you say to the patient? Will you say, I'm hearing it too? Minsan yan ang problema natin, umamin tayo. Pag nakakita tayo ng schizophrenia doon sa ating RLE, bigla natin sabihin, ay may hallucination yan. Kaya first interaction pa lang, tinatanong mo kagad yung schizophrenic na patient, may naririnig ka bang mga boses? Sasagot naman yung schizophrenic patient, meron, yung boses mo. Oh, di ba? Kasi naman, hindi mo dapat ini-elicit yun. Kailangan, antayin mo bago niya i-manifest and then intervene. Present reality. Say, I understand you might be hearing some voices. It must be real to you, but I don't hear any voice except yours and mine. O, di ba? Sige, tawa pa, Marie. Okay, now, sir, bakit yung discharge chart ng may schizophrenia ang nakalagay? Schizophrenia in remission. Kasi schizophrenia is a lifelong disorder. Okay? And there's 1% in the general population when it comes to risk. So in other words, pag 1,000 tayo ngayon dito sa ating webinar, okay? Isa sa atin ang magiging schizophrenic, most at risk. Huwag kang tumingin sa akin. I know what to do. Okay, so let's move on. So let's try answering a sample question related to schizophrenia. A schizophrenic client with delusion of persecution tells the nurse that he believes that a relative would soon kill him and he might as well commit suicide before that happens. The priority nursing diagnosis of the patient is, eto ha, eto minsan nagkakaproblema ang mga estudyante nagbo-board exam. Hindi nila alam alin ang basis ng sagot. Majority of those who will answer this question would say letter A, risk for injury daw kasi magsusuicide. Tapos may auditory hallucination. What I'm trying to tell you is get down to the main problem. Ano ang main problem ng schizophrenia? Di ba excess dopamine that leads to altered thought process? So, the manifestation is just a delusion, but the main problem should be the basis of your diagnosis. So, we need our functional concepts to come in. Let's go. The first sign of schizophrenia is personality changes, and you have the general manifestations. So, I have here the code schizophrenia. That's something I formulated. Social isolation, catatonic behavior, hallucination, incoherence, lack of interest or anhedonia, obvious failure to attain expected levels of development, peculiar behavior, hygiene and grooming are impaired, recurrent illusions and unusual perceptual experiences, exacerbation, ibig sabihin may time na aktibo, and remission, may time na nawawala yung symptoms. No organic factor accounts for the signs and symptoms, so wala siyang ibang sakit para masabing bakit meron siyang delusions. Inability to return to baseline functioning after each relapse, and then the affect is inappropriate. Now, apakarami sir, 7 days na lang, mag-aaral pa ako MS, mag-aaral pa ako Funda, mag-aaral pa ako CHN. Yun na lang mga common na kailangan mong malaman. Ang tandaan mo, hallucination, anong priority nursing diagnosis mo dyan? Impaired sensory perception or altered sensory perception. Lack of interest or anhedonia. Okay? So, impaired social interaction, ang priority mo. Recurrent illusion. Ano ba difference ng illusion sa hallucination? Yung hallucination, there is no stimulation. Okay? There is no external stimuli. Sa illusion, you misperceive an external stimuli. Meron kang nakikita pero iba ang tingin mo. So sa malayo, ang tingin mo, kabayo, nung nilapitan mo, pusa lang pala. Mas ganda lang ang peg. Okay, so, focus. The appropriate nursing diagnosis for clients with schizophrenia is altered thought process because that's the main problem of the schizophrenic patient. So we go back to the question. Sir, bakit altered thought process? Sabi niya, di ba, meron siyang delusion. At yung delusion niya ay papatayin siya ng relative. O the risk for injury. No. Yung sinasabi niyang papatayin siya ng relative is just a manifestation. Delusion is just a manifestation of schizophrenia. Delusion, it's what you apply at night before you sleep. Delusion. Hindi, ang gulo kong kausap. Okay. So, listen up. Nurses to be and top-notchers to be. Pagka ganyan ang tanong, get down to the main problem. That is your basis for your priority diagnosis. The main problem in schizophrenia is excess dopamine that leads to altered thought process. So that should be your priority nursing diagnosis. Altered thought process pa rin. Number 2 sa topic ko, bleeding disorders of pregnancy. Now take note, hindi lahat ng pagdurugo sa pregnancy ay dangerous. Sa first month, in the first trimester, may tinatawag tayong implantation bleeding. Okay, and once again, that just has to be noted, and eventually you tell that to the doctor, but it doesn't require immediate consultation. Okay, now the 2 important things that you have to remember would be placenta previa and abruptio placenta. What's the difference? Placenta previa is abnormal location of the placenta. So it either partially or fully covers the mother's cervix. So the implantation area okay, is near the cervix. That's why there's bright red vaginal bleeding, and your priority should be to manage the bleeding, put the patient at rest. If there's severe bleeding, then administer BT as prescribed. And then if the mom is able to reach 36 weeks, then they will undergo C-section. Now, to contrast, abruptio placenta has a normal placental implantation area. However, there is premature separation. So the abnormality is on the separation. And this could be either triggered by trauma, hypertension, or cocaine abuse. Kaya nga, pag nabangga yung buntis, chances are abruptio placenta yan. So they would usually have uterine contractions that could lead to preterm labor and uterine rigidity. So once again, manage the bleeding, put the patient at rest, and administer blood transfusion for severe bleeding as prescribed. Now, if it's mild, then you can wait until the patient is at full term, and then the doctor may opt to do normal spontaneous delivery of the baby. However, pag may bleeding talaga, C-section. Okay. So this is how it looks like. Placenta previa, you have abnormal implantation of the placenta. So it could be low implantation, okay, partial placenta previa, and total placenta previa, where the placenta covers the cervical os completely. In abruptio placenta, there could be covert bleeding. Covert hindi napapansin kasi sa gitna nag-separate. Nakadikit yung placenta, sa gitna siya nag-separate na ganyan. So nasa loob yung bleeding. So monitor the vital signs. The heart rate could go up and the BP could go down, which means the patient is going to shock. And then meron ding nag-separate siya sa edge. So that leads to overt bleeding. So yun yung napapansin na type ng bleeding. So the patient will have a dark red vaginal bleeding. So, multiparity is a risk factor for both abruptio placenta and placenta previa. Abruptio placenta requires immediate CS delivery. Using the knowledge now that we learned, let's answer a sample question in SATA form. Which of the following factors are considered as risk factors in placenta previa? Trauma, hindi. Sa abruptio yan. Increased parity, yes. Advancing maternal age, yes. Cocaine abuse, hindi. Sa abruptio yan. Ang tinatanong dito, placenta previa. So, you put an X. Past cesarean birth, yes, for placenta previa. Hypertension, hindi. Sa abruptio yan. So, tatanda mo sa abruptio, hypertension, cocaine abuse, trauma. The rest, sa placenta previa na yan. Okay? And my number one topic, COPD. Okay. Here's a functional concept. In COPD, the airways become inflamed and narrowed. When you talk of COPD, we have two main problems. You have bronchitis and emphysema. Dati kasama ang asthma dito, pero nung ni-revise na yung ating classification, ay in-separate na ang asthma. So what happens in bronchitis? You have inflammation of the lining of bronchial tubes. Remember the symptoms? You have the code BLOW. Breathlessness or body aches, low fever, oxygen hunger due to blocked nose or sinuses, and then wheezing. So treatment is RFO. Rest, administer fluids, and over-the-counter bronchodilators. Okay? Emphysema would mean there's damage to the alveoli, which limits the exchange of oxygen and carbon dioxide at the alveolo-capillary membrane. So sometimes the overdilated alveoli it's now called a bullae, okay? Because it could no longer facilitate exchange of carbon dioxide and oxygen. So the symptoms would include ABC. Impaired alertness. Alertness is impaired. Breath is short. Color changes. You have blue-gray fingernails. So that's cyanosis. Once again, the treatment would be drugs and, of course, administration of oxygen. The drugs could involve your bronchodilator. So when a patient has bronchitis and emphysema, usually they have COPD. COPD is an old man's disease. And the number one cause is tobacco smoking. So the main cause is tobacco smoking. Now, what are the common risk factors? Okay, genetics, yes. Aging, yes. Smoking, yes. Pollution, yes. Chemicals, yes. You have the code GAS PC. And then weight loss is not a risk factor, it is a sign. Because usually, yung may COPD, namamayat. Okay. Now, the symptoms of COPD include frequent coughing or wheezing, increased or excessive phlegm or sputum, shortness of breath, and having trouble taking a deep breath. So you have the code FISH. Okay. FISH. Okay. Now, COPD is diagnosed with spirometry. Okay. So the interventions for COPD includes, remember, instruct the client to quit. Number one, quit smoking, remain upright, okay, especially during an attack, intervention with drugs. Now, if the patient with COPD has a coexisting asthma, nako, para naman niyang pinakyaw na ang mga sakit. You have to know the difference between cromolyn and theophylline. Cromolyn sodium is used for the prevention of asthmatic attack. Theophylline is used during an asthmatic attack. So pag wala pang asthma, mukhang aatakihin pa lang, pwede na magbigay ng cromolyn. That's a drug of choice. Cromolyn is no longer effective pag meron na siyang asthmatic attack. So it's used for prophylaxis. Theophylline, on the other hand, tatandaan, okay, is a bronchodilator during the asthmatic attack. So, and then the patient will have oxygen therapy. It could be from 1 to 2 or 2 to 4 liters of oxygen. Hindi na sinasabi ngayon na strictly 2 to 3 liters na. Okay, that's old school. Recent evidence suggests that you could actually increase the oxygen up to 4 liters per minute if the patient needs it. Okay? So, a client with COPD who develops a complication like bacterial pneumonia is a priority. So let's try to use that to answer a question. Which of the following clients should the nurse evaluate first? Client with COPD with cough? Cough is expected. So a client with symptoms that is expected of a disease is not a priority. That's a functional concept. Client with COPD with dyspnea? Dyspnea is expected in COPD. Client with COPD with rusty sputum indicates pneumonia, which is a complication. And then a client with COPD with tachypnea, that's expected. So the best answer is letter C. Okay, so that ends my presentation. Always remember this thing. Prove yourself to yourself, not to others. Never ever compare yourself. That will not bring in goodwill. Accept the limitations and the human frailty of other people as they come. Don't be affected by it. Always remain positive. Do not give your past, for those who are taking the test second or third time, okay? Do not give your past the power to define your future. Always stay positive and remember, success will come to you. You just have to be disciplined. You have to wait. And when your time comes, hit it big. So, thank you with that. And I'd like to share with you a reminder. Sabi ng State Board ng Mexico, kung gusto mo daw mag-take ng NCLEX, kailangan mag-take ka within 2 years of graduation. Kasi pag hindi ka nag-take, kailangan mo ng refresher course. Okay? That's just additional information. Thank you so much. And now, I think I've set the stage for, okay, the presentation of Dr. Arquiza. Thank you very much, Sir Miko. I'd be more than willing to answer the questions after Dr. Arquiza's presentation. Maraming salamat po sa inyong lahat.